doctor to take care of your concerns. This week, we are going to be joined by a very well-known doctor who has been doing tremendous work in the field of pediatrics. And she's going to help us understand about the challenging behaviors in infants, kids, and toddlers. As a parent, we face multiple challenges while dealing with our kids. We always want the best for them, but sometimes their behaviors are unexplainable. We are not able to find out the reason for that. What is going on in their mind? How can we try to get the best out of them and also make them happier, give them a better environment, right? So Dr. Sujitha is going to help us a lot with understanding them and what is the physical, mental, and behavioral changes that kids go through. She is going to help us understand them. At Cureka, we are working very hard to bring you best of products from best of doctors. So our in-house doctors led by Dr. Hema Satish, who is the co-founder of the company and dermatologist herself, and Dr. Satish Devdas, who is also the co-founder of the company, and he's an orthopedic surgeon. They handpick products, vet them, make sure they are excellent for your healthy living. They are good to be taken and consumed for a longer period of time without any toxins on, and used or applied in various forms that different products are there. Only those products are promoted and sold on our website. No other product we are keeping like cosmetics or any other brand which is harmful for you. So you can trust Cureka to take care of your healthy living, to guide you which products are suitable for you. To help you doing that, we have got a free of cost WhatsApp platform that our teams support you in that, and you can ask questions to them as to, let's say, a lot of people ask us a lot of questions around, let's say, their babies, what should be, how to use a particular product, what is the dosage levels, or if they've got acne, then, which products are best suited for them, like that. And accordingly, the people purchase the products. Now, again, there's no obligation. You can buy from anywhere you want. And these products are sent to you and within the fastest possible time through, national couriers. So we're waiting for Dr. Sujitha to come in. She's going to join us in just a few seconds from now. Yeah. So, Dr. Sujitha, are you here? I mean, we can't see you. I think she's going to join us in a while. Yeah. So she's here. Good morning, Dr. Sujitha. How are you? Am I audible to you? Can you hear me? Great. Wonderful to have you with us in our weekly live session, Dr. Sujitha. And thank you so much for giving us your time. So, Doctor, today we are going to talk about a very important topic, which is challenging behaviors of toddlers and children, right? So, you must be getting a lot of patients who are coming with this problem, right? So, let's start with the discussion on the questions that we have received from our listeners and our customers and people who want to ask questions. So, what are the common behavioral problems in children, Doctor?
That's what you told. This topic is going to be interesting because I think many parents have so much doubts that my child behavior is normal or when I should see my doctor. I think this session will be help to relieve some of your doubts regarding your child's behavior. Coming to the question you asked, what are the common behavioral problems? Actually, the common behavioral problems we can divide into habit disorder, such as habit disorders are normal, such as a child might do thumb sucking, nail biting, or throwing in objects, or doing nail biting, everything, which is making some repeated sounds. These are actually normal till some particular age. But even after that particular age, the child is doing these things, then you should see the doctor. Then another main thing is that anxiety. Even the child also can have anxiety and depression. But many child are attached to their parents, so they try to avoid going to the school. They have like school phobia. In such cases, we have to address the issues with the child, and we have to communicate with the school teachers, everyone, that take care of my child little more. And the main another common problem is that oppositional behavior. Like many parents will tell, my child is not even arguing with me, not even listening to me. He keeps yelling at me and he's not obeying anything. These are some of the oppositional behavior. These behavior will be till 5 to 6 years. But after 5 to 6 years also, if your child is behaving like this and he's doing harm to others also, then you have to see the doctor. And the main thing is that ADHD. Now many people have heard about this term like ADHD, which is nothing but attention deficit hyperactive disorder. This is nothing but this will be seen in like 5 to 6% of school going children, especially boys. In this condition, a child might be hyperactive and inattentive in the class, and they'll do things without even thinking. These are also some condition. And another main thing which is coming into limelight is autism. Autism is still not clear what is the cause for autism, especially preterm babies and low birth weight babies, and some genetics also has been associated with autism. In autism also, the child has like no eye contact and they want to play alone, little different from other kids also. But this can be diagnosed earlier if you find the symptoms earlier, and if you see the doctor, it can be rectified somewhat earlier.
Right. Right. Thank you so much, doctor, for sharing that. I'm sure that is quite helpful for a lot of parents who are listening to us. So, guys, if you have got any questions on this topic, please feel free to mention in the comment section below, and we will try to come back to you. You will be listening to us on multiple platforms. We are live and we are posting this video across all channels, whether it is Facebook or Twitter, Instagram, LinkedIn, YouTube, anywhere. You can post your question and we'll try to come back to you. Yeah, thank you so much. So, doctor, what are the causes of behavioral problems in children? Previously, we discussed about what are the common problems. Now, let's try to understand what are the causes for them.
Yeah, it can be either the causes might be because of the child or because of the parents. Child factors might be the child has any developmental delay, or child has some speech delay, or child has any hearing impairment, or a child has not proper sleep and using increased screen time. Nowadays the kids are using mobiles, gadgets, TVs, which is that's why main behavioral problems is because of increased screen time also, and the child is not taking proper diet, everything. This might be some of the factors of child side, but the main thing is that because of the parent attitude. Some parents might be very strict with the child, or some might be neglecting the child. Both is actually not good. Even if you are strict with the child, or even if you are not caring about what they are doing, then this will be lead to the behavioral problems in the child. Especially in case of broken family or any child abuse, the child behavioral problems is comparatively more compared to the normal living environment child.
Okay. Thank you so much for sharing that. So it's very important to provide a safe and a secure environment to the kids, I believe, like how you mentioned about broken families. That's very true. And one of the listeners is asking doctor that, her child, she has a 3-year-old child who is throwing objects, hitting and head banging. So she's asking, is it normal or how to control it?
Actually, 3-year-old child is actually normal. Like 2 to 5-year-old child will do hitting objects, throws, everything. This is what we call it as temper tantrums. Because during this time, the child language is not fully developed. So they can't express their emotions through language. So they throw objects to get attention, or not to do something. They'll protest like this, like doing throwing objects, everything. This is actually normal. You need not worry about it. Mostly the child, but during this temper tantrums, you should not give much attention to the child. So I'll tell them to give some time out. Time out is nothing but you take the child and keep it somewhere in a quiet place for some time, like 1 or 2 minutes, so that the child forgets the behavior, and both the parents can also calm during this situation. This is actually normal, you need not worry. But after 5 to 6 years also the child is doing this and he is harming others and even doing self-harming, then you have to visit the doctor.
Understood, doctor. Sure. So, doctor, is thumb sucking normal, and until what age the child should stop thumb sucking?
Actually, thumb sucking is normal because even newborns do thumb sucking, which is natural because they have a specific sucking, rooting reflex. They do thumb sucking. But after 2 years, the child tried to stop thumb sucking. By 5 years, they should stop thumb sucking because as they go to school, they should stop thumb sucking. But many child will continue to do thumb sucking because whenever the child has some fear or anxiety, they try to do thumb sucking. So you have to find which situations are making your child to do thumb sucking to try to avoid that situations. And you can give gifts or rewards whenever the child is not doing thumb sucking. You can encourage them, but don't scold them. And even after doing these measures, also the child is still continuing thumb sucking after 5 years. You have to see a dentist and pediatrician because while doing thumb sucking, your front upper teeth will come a little outward, so they won't be in align with the lower teeth. Because after 6 years, your permanent tooth starts coming. So after permanent tooth comes also, if you still thumb sucking, then your front teeth might be protruded and you will have some palatal issues also. So till 6 years, if your child still thumb sucking, you can see the pediatrician and as well as the dentist because they give some bitter medications or there's something called thumb sucking god also. There's some device,
Yeah.
like a glove, it will be there to prevent your child from doing thumb sucking. But
Right.
you can
Right.
wait
Thank you.
till 5 years.
Until 5 years. Okay.
Mm.
Right. True. So, doctor, one of the listeners is asking us a question that whenever she sees her child cry with anger, he suddenly becomes silent and has breathing difficulty. Is this normal?
Yeah, this is normal only. Previously, I told temper tantrums, no? The same thing is that whenever the child cries with anger or frustration, especially when the child from 6 months to 6 years, especially after 18 months, whenever the child cries with anger, they have some little breathing difficulty. They start to hold the breath. So they'll be little silent for some time. So parents might be panicked. What happened to my children? Is there something wrong? This is actually normal only. You need not worry like after 1 or 2 minutes they'll be back to normal, but this is what we call it as breath holding spells. It can be either a blue spell or a white spell. Blue spell is something that like whenever the child cries they become like little blue. This is also normal
Oh.
because of little oxygen while crying they'll have like this thing which is actually normal. Whereas pale spell is that here the child cries but you can't hear the sound. They have little low heart rate and they'll have like a limp thing, which is like which will be just for like 1 or 2 minutes, which is normal. But when this is going more than 5 minutes, the child is unconscious for more than 5 minutes, then it is something wrong with your child. Then you have to take it to the doctor. But this breath holding spells is normal. Like even in a one time per day is also normal. But it is coming like more than 2 to 3 times per day or continuously coming for more than 1 week. You have to see the doctor because breath holding spells is associated with iron deficiency anemia also. So if you correct this iron deficiency anemia, you can control this breath holding spells. But you need
Right.
not worry if it is less than 1 or 2 minutes.
Okay. Okay. Right. Thank you so much for sharing that, doctor. Doctor, one of the customers is asking us that how do I time out in a way that is helpful?
That's what whenever your child has like throwing temper tantrums, throwing objects, not obeying you, you can do a timeout. Timeout is nothing but you place your child in a quiet environment, like in a particular room, like in the corner. You place either a chair with a stuffed animal or anything. You keep the child for 1 or 2 minutes. But during that time, you should not speak to your child. The child should be simply sitting silently so that he understand what he does, and you should also be calm during that time, but you should also watch him, but don't talk with him, but you can watch him because you have to monitor him what he is doing also. So this can be done, but like preferably done after 2 years when the child becomes 2 years, like 2 to 5 years. You can do this like just for 1 or 2 minutes alone. While doing this should be done immediately after temper tantrums, then only they'll realize their mistakes. So this will be helpful whenever they do some wrong things or doing some dangerous things. To avoid this, we can do this timeout. This might be helpful if you continuously doing, like after 2 months, it will be very helpful.
Right. So, doctor, a parent has a question and they are asking, my child is eating chalk, paint, and mud. Is it normal and how to prevent this?
Yeah, this actually many kids might eat chalk, mud, everything. This is normal only. You need not worry. But like that's what I told. That during 2 years, the child might start to explore things. Even whatever things they get in their hand, they try to keep it, put it in their mouth only. During this time, you have to be little careful because some things are inedible. So it might harm your child also. It might cause lead poisoning also, even obstruct their intestine, have breathlessness, allergies, even worm infestations can happen. So this is still 5 to 6 years, it's normal, especially the child with some developmental delay like autism or ADHD childs. These child have more prone to have this thing like eating mud. This is what we call as pica. This is normal, but what if your child is continuously doing for 1 month? You have to see the doctor because this might be something because of iron deficiency or zinc deficiency or calcium deficiency. This might be one reason that your child is eating these inedible substances. So you have to evaluate the child and give supplements to rectify this nutritional deficiency. And another thing is that you have to deworm the child because of this thing, because they are eating inedible things. There might be worm infestation also. So every 6 months once you have to deworm your child to prevent this child getting worm infestation because of pica. But if it is more than 5 years, the child is still eating these things, you have to consult the doctor.
Right, right. Thank you for sharing that, doctor. So, doctor, another parent is asking us, my 10 years old child is still wetting the bed. How to prevent this, and do I need to consult a pediatrician?
Yeah, most of the child might be dry by day. That is dry by day. They'll be able to pass urine during the daytime by 2 years, but the nighttime dry will be happening only after 3 years only. So, but after 5 to 6 years also, if your child is still continuing to wetting the bed in the night, then you have to take actions because it might be sometimes it might be because of some hormonal problems or because of any sleep problem. Sometimes a child who's in deep sleep might wet the bed during the night also without even knowing. And sometimes there might be any urinary infections also, or because of some medications also, the child might wet the bed. Actually, you have to see what is the reason. If even if you can't find any of these reasons, then you have to follow this doctor's advice. What we prescribe is that don't give any fluids before 1 hour before bed, and try to make the child pee before going to the bed also. And after sleeping at least once in a night, you can wake the child and ask them to void in the toilet. This toilet training, if you keep on doing, they'll be adapting to this also. But even after following this also, you can't control this, he's still wetting now, then you can see the pediatrician. They can prescribe some medications so that they will, this will be rectified.
Sure, sure. Thank you so much. So I believe a lot of parents would be, happy with the answers, and they are getting a lot of insights, guys. If you have got any questions on this topic, because at different times we all face these challenges with the kids, please do mention in the comment section below, and we will try to take them up during this live session, or doctor will come back to you later if your question is asked a little bit later. So, doctor, what are the early signs of autism?
That's what I told. Autism has now come into the limelight. Actually, you can even find it as early as like 18 months itself. You can find it out. But till 3 years, it might take to fully develop the signs. But if you find it, pick it out earlier. So it will be easy for the doctor as well as parents to cope up with this. Because autism has been little still is a complex thing. So understanding is much required both for the doctors as well as the parents. first thing is that the child won't make eye contact with you, because the eye contact will come after 5 to 6 months itself. The child starts having eye contact with their parents, especially. But the autistic child won't even have an eye contact. And the normal child will start to say like mama, baba at around like 6 months to 9 months itself. But even after 1.5 years also, these child won't have like proper language. They won't even say mama, papa thing and all. And they won't play with other kids also. They play with only a particular toy only, and they repeatedly doing some repetitive movements. These are some earliest signs that you can find it. If your child has like this signs, you can consult your pediatrician immediately.
Right, right. Thank you so much, doctor, for sharing that. Doctor, what are the symptoms, if you talk about of autism, that parents and caregivers they can look for?
That's what all symptoms I previously discussed is earliest signs. But by 3 years, you can find these signs so that you can find it easily. The child will particularly play with a particular toy and they repetitively do some movements, and they try to avoid playing with other kids. Even if the parents hugs them, they'll feel little discomfort. They don't even feel attached to their parents also. And then they only if they play with a particular toy, if you take the toy, they become very angry also, and they will be very reluctant to some sounds, noises. They become very fear with some noises, everything. These are some signs that the autistic child has. If you find these signs, you can see the doctor, because earlier treatment is better if you diagnose later.
Right. Sure, doctor. So, I mean, coming to another question on autism itself, because a lot of patients might want to know this. Are there any treatments for autism?
That's what there is no particular treatment for the autism, but many co-occurring problems there in autism, like that. Already I told they have like speech delay and language delay might be there. So we have to give a speech therapy, language therapy, and behavioral therapy. Behavioral therapy is nothing but not only doctors who should counsel the babies. The parents should be getting involved with the babies. They have to talk with them and have to tell them which behavior is good, which is bad, and they have to train their child. And occupational therapy is nothing but this therapy helps the child to do whatever daily day-to-day activities like eating, dressing themselves, writing, everything. These therapy will help the child to live like other child also. And the main teaching therapy is also there. There is a particular teaching approach just for autistic children, because they can't cope up with the education as such as a normal child. There is many such organization and schools for autistic child, because it will help them to attain some education and knowledge, which will be very slow, but they will be very helpful for this autistic child. But we can, if the autistic child has some violent behavior or very hyperactive which can't be controlled, in such cases we can give some medications to control this behavior. As of such, there is no particular treatment for autism, but by this therapy, we can make our child look like a normal child.
Right, right. Thank you for sharing that, doctor. And doctor, there is a parent who wants to know, my 5 years old boy is hyperactive and not attentive in school. What should I do?
This is what I previously told. This is mostly looking like ADHD, like attention deficit hyperactive disorder. But this might be normal also. Even many of the child might be hyperactive and inattentive in the school. This is normal also. But mostly this ADHD will be seen in school children, especially before 6 to 7 years. But if your child is doing both in the school and as well as in the home, then it is ADHD. If the child is doing only in the school, then it is normal. You need not worry. But if the child does the same behavior both in the school as well as in the home for more than 6 months, then it might be ADHD. That's what I told. ADHD is nothing but attention deficit hyperactive behavior. Here the child becomes very hyperactive, inattentive in the school. They'll be daydream and they won't do particular work. Their academic performance will be little low. They'll do things without even thinking. They won't play with other kids. They might injure other kids also. This is little we have to be cautious because these child might harm other child also. They can do self-harm also. In such cases, we have to do behavioral therapy and certain medications to reduce their hyperactive behavior.
Right, right. Thank you so much for sharing that, doctor. Doctor, another parent is asking us a question. What effect will too much screen time, whether it is television or whether it is mobile phone, will have on my child?
That's what I told. The main cause for behavioral problem increasing in nowadays is because of increased too much screen time. Because now even kids having mobile phones, gadgets, which makes them addictive to this content, which contents are more, which is not age appropriate contents. These kids are seeing more violence and inappropriate content, which affects their behavioral problems also. That's why doctors will advise you not to use screen time much. Till at least 2 years, you should not give your any screen. No screen time is allowed for till 2 years. Even if your child wants, you can do only video calls. But like 2 to 5 years, it should be like 1 hour per day. That too, you should watch it along with your kids. You should not give the phone to the kids. After 5 years, the child can have like 1 or 2 hours per day. If too much screen time is there, that might be one of your problem that your child is misbehaving or doing something harm. So try to avoid screen time.
Sure, doctor. So, but a lot of parents have this query also that, if we are not giving the device to the kid or not allowing them to watch the TV, they won't have their food or they won't eat properly.
That's
That's
because
a common
actually we
problem.
have to blame the parents only. Because after like 6 to when we start weaning, like after 6 months of age, during that time they only try to show the rhymes or anything and making them eat. They only started the habit. We should not blame the kids because they only make it as a habit so that their time will be less consuming. The child will eat faster. And we are thinking that the child will eat properly if you show the phone, but that might be one reason that your child has obesity because watching screen time they eat more and more. That might be one reason your child is getting obesity. Before generation and all has not watched TV or phones and while eating, but nowadays this generation is because of the parents' attitude only. So I won't blame kids in this condition.
Right, right, true. So, doctor, does parenting style affect a child's behavior?
That's what I told. Parents' attitude is the main thing that your child's behavior is affected. Because there is four types of parenting style. First, we call it as authoritarian. Here the parents will be very strict. They impose rules on the child. If they are not obeying, they'll keep beating the child, scolds the child, typically like a military thing they'll do. This is also you should not do. The another main thing, another type of parenting style is authoritarian, which is nothing but here also the parents will give some rules, but when the child doesn't do the rules properly, they'll interact with the child. They'll ask what is the problem, why you can't do this, it will be helpful for you. They'll have like interaction with the child. This is like a good parenting method. I prefer like authoritarian parenting will make your child sustain a good life in future. And another parenting is permissive. Here the parents, whatever the child asks, they'll give. There will be no rules. They won't even, they'll be like friendly, but they won't beat the child. They won't even care. Even if they not do also, they won't worry. Even if you not study, it's okay. This is like a permissive parent. This is also you should not do because it might affect the child's future also. The another main thing is that uninvolved parenting. That's what many broken families or low socioeconomic families, they neglect their child's interest, everything. They won't even care what the child does. This might be one reason that your child is becoming very violent in future and they're not doing very good in academic performance. So I prefer that you should be like authoritarian parent so that you can give some rules also and you can still be calm and composed and think and tell whatever the child does, good or bad, and how to rectify it. You can calmly interact with the child.
Right, Right. Thank you so much for sharing that, doctor. That's so true for a lot of parents and who are all listening to us must be thinking, okay, I am from that parenting style. This is what I follow when you are sharing all of that. But that's very helpful. Thank you so much for that. So, final question, doctor. We are short on time for the day. When to seek doctors' help for behavioral problems? What is the right time?
That's what I told you before. When you find any misbehaving with your child or throwing temper tantrums or everything, you can just give some rule, make some rules and make them behave, or you can use the timeout method. But even after doing so much of things, also if your child continuously doing the same thing and he can't attend the school properly, you are getting so much complaints from the school that he is not properly listening, he is very hyperactive and he does any harm to others, or he is self-harming, or he is harming any animals or even friends or anything, and he tries to steal things, then this is something more serious. During this condition, you can't even you only parents can't rectify this. At this time, you have to see a psychologist as well as a pediatrician, where they will guide you what are the problems is there, and they'll give some therapy, behavioral therapy to rectify this. Because if we rectify before itself, before 10 years itself, it will be very useful both for the kids and parents to lead a enjoyable, sustainable, happy life.
Sure, sure. Thank you so much for sharing that, doctor. And it has been a wonderful session where you shared a lot of insights around the challenging behaviors that we see commonly in a lot of children. So, thank you so much for that. And we look forward to connecting with you again in the future. Wish you a very, very happy weekend, doctor.
Thank you so much. I think I've discussed only half of the behavioral problems. Even if you have
Okay.
so much doubts, you can connect
Right.
through Cureka, and
Yes.
then you can ask whatever questions you want to clarify. And many of the parents, you need not worry. Doctors are with you for your help. You need not worry.
Sure, sure. Thank you so much, doctor. Take care.
Thank you.
So, guys, that was Dr. Sujitha Natarajan who was with us, and she helped us to answer a lot of questions that surround parents, especially parents of young age children who face the challenging behavioral problems in their children. Uh, do, I believe this session has got a lot of inputs for the parents for multiple diversity of the challenges that kids pose to the challenge based on their behaviors. Please do share them with all the parents that you know. This will be really helpful for them. This will help them to calm down and understand what is going through their kids' mind. So share this with as many people, as many parents that you know, and do let us know if there is anything specific that you want us to cover in our next sessions, whether it is any concern, any topic, something affecting you, something that is concerning you. We will be more than happy to provide you a solution for that. As always, this is Rahul Nanuhal signing off for today. Thank you so much for joining us today, and we wish you a very, very happy weekend, guys.